Good day, Ma'am Kelia. I am Marjorie M. Dela Rosa from BSN 1A, and in this video, I'll be performing the proper procedure for the ears, nose, and mouth assessment. And before starting the assessment, we must do the following. So first is to assemble or gather the proper equipments for this assessment, such as the tongue depressor, the tuning fork, the gauze pads, the otoscope, or I'll be using the pen light and gloves. Next is to introduce yourself, explain to the patient what you're going to be doing and why is it necessary, and explain how can the patient cooperate. Then perform the proper medical hand washing procedure and observe the other appropriate infection control procedures such as wearing your gloves or wearing mask. Next is to provide privacy for the client and determine the client history and specific assessment area, and this can be done by asking them questions. Then begin the assessment.
Come in.
Good morning.
Good morning.
You are Miss Dela Rosa, right?
Yes.
Okay, so I am Marjorie M. Dela Rosa. I am a student nurse in here, and today I'll be assessing your ears, nose, and mouth. Is that alright?
Yes.
Okay, so this is necessary, so we know that you don't have any abnormalities, no hearing loss, or your taste is good, or your areas are functioning well. Okay, so how can you cooperate? You can just relax and just listen to what I'm gonna be saying. Like if I tell you to turn your head sideways, so we can observe and inspect the areas properly. Okay.
Okay.
Okay, so before we start anything, I'll be washing my hands first. Okay.
Okay.
Okay, so I'll be back. So we will be beginning this assessment by your oracles. Is that alright with you?
Yes.
Okay, so before we begin anything, I'll be reminding you that I'm going to be touching your face, but I have washed my hand as I mentioned earlier, so is that alright with you?
Yes.
Okay, so first is we're going to be inspecting the oracles for their color and symmetry and the position. So first thing's the color. Can you please turn your head shot sideways? Alright, another side. Alright, so we don't see any extreme redness, which can be a sign for irritation in the ears. So there is none, and there is no discoloration, no purple or blue, so that is normal lang. So next is for the symmetry of the symmetry of their sizes. So as you can see in here, they are similar, or they have the same size naman. Okay, so now for their position, can you please look here straight forward? Alright, so nothing is any being lower, there's no higher, so they're just the same. They have equal size and position. So next, we're going to be palpating them. Is that alright?
Yes.
Okay, so we're going to be palpating for the texture in here. So we feel that it is soft and just fine. There's no bumps or lumps, so that is good. Next is for their elasticity. So I'm gonna be pulling some parts. Is that alright?
Yes.
Okay, so here. So they have good elasticity. Okay. So now is for the tenderness. Tell me if you feel pain if I palpate these areas, okay?
Alright.
Alright. Is there anything that hurt?
No.
No. Okay, the other side. Is there anything that hurt?
No.
No. Okay, that's good. That's good. So now we're going to be inspecting the external ear canal and the tympanic membrane or the eardrum. So for this procedure, we're going to be using the otoscope, or in my case, the pen light, because I don't have an otoscope. So what we're going to be doing first is to get our otoscope or pen light and inspect the external ear canal for the cerumen, any lesions, any pons or blood. Okay, so in here. Can you turn your head sideways? Okay, there's one. Okay, there is none. We don't see any abnormalities as mentioned earlier. There is no blood or cerumen or lesions. Next will be the tympanic membrane or the eardrum. So you must see that it is clear. Can you extend your? So in here we must see that it is clear because a ruptured eardrum can cause hearing loss. So there, we inspected for the color and the gloss of the tympanic membrane. So this is all good. I don't see any abnormalities as I have inspected them. So there's no problem with the auricles, external ear canal, and the tympanic membrane of the client. So now we're going to be assessing the patient's hearing. So we're going to be doing the gross hearing acuity test. This is composed of 3. First is the whisper hearing test, and the ringing test, and the Weber test. So first we're going to be doing the whisper hearing test. I'm going to be occluding one ear per client, and the patient should be able to repeat what I'm going to be whispering. So we're going to be starting, ma'am. Okay?
Okay.
Okay.
Balloon.
Okay. Other side.
Pillow.
Alright, so that's good. Next, we're going to be doing the ring test. So we're going to be needing a tuning fork for that. So in here, the tuning fork will have vibration, which the patient could be able to hear. So if there is problem in their hearing, the sound wouldn't be able to, the client wouldn't be able to hear those sounds. So we're going to be starting. Okay.
Okay.
Okay. In here, the side.
Okay.
Okay. The other side.
Okay. Okay.
Okay. Ma'am, do you feel it both in here?
Yes.
Okay. So now we're gonna try the side same. Okay. Okay.
Okay.
Alright, so now we're going to be doing the Weber test. We're going to be putting it in here on the top, and the vibration will be able to go here, down the side of the patient, and would still be able to hear and feel the vibration. Now, okay?
Okay.
Alright, so I'm going to be asking you questions now. Okay. Were you able to hear those vibration in your right ear?
Yes.
Okay, how about in your left ear?
Yes.
Okay, now when I put the tuning fork in your side, were you still able to hear those sounds?
Yes.
Okay, how about in your left ear?
Yes.
Okay, so how about when I did the Weber test, when I put it on top of your head, did you feel the vibration going down in here and hearing the sound?
Yes.
Alright, so as I saw, we're going to be documenting the findings that we found, and for this one, I am going to be concluding that the patient has good hearing. It's just normal. When I inspected earlier and palpated, there is no tenderness in the elation here. There's no problems. And when I saw inside of the eardrum, there was no abnormalities, no lesions, no blood. So that is good. And when we performed the hearing test, we had good results and the patient can hear them properly. So that would be all for the hearing test or the ear test. Alright, so now we're going to be doing the assessment for the nose or the nasal areas of the client and the sinuses. So in here, ma'am, as we are going to be assessing your nose and maxillary and the mouth later on, may you please remove your mask for a while so we can check properly?
Alright.
Alright, so for this one, what we're going to be doing is we're going to be inspecting the external nose for any deviation in shape, size, discharge, the nares, and any redness or soreness or flaring that can be signs of irritation. So in here, as we see, I'm going to be touching your face, right? Okay?
Okay.
Okay, so in here, as we see, there's no redness in here. Nothing. There's no flaring. There's no discharge. It's dry. Then yes, it's all right. I don't see any irritation in her nose area or the nasal area. So now what we're gonna be doing, we're gonna check that. Okay, now we're gonna be lightly palpating the nose area. For this part, I'm gonna be using gloves so that we make sure, because we're touching the patient's nose, so the patient's face, so you have to be careful. Alright, so here you have now. Now we're going to be determining areas of tenderness. And here we're going to be touching some parts. Ma'am, can you feel any pain in here?
No.
No. Alright, so now for any masses, we're going to be checking in here. There's no masses or any lumps or bumps, and any displacement. I don't think there's any displacement, ma'am. May I see? See, I don't see any displacement in the nose. It's not sideways, it's straight. Her nose is straight. So now we have that. We're going to be determining the patency of the nose. So to do this, so the patency of the nares or the nose is the measurement of how open the nose is. Here, the opening of the nose are. So to do this, we're going to be covering ask the patient to cover the mouth. Okay, as you can see, the patient's mouth is closed already. And now we're going to be putting pressure in here in the other opening or the other nair, and ask the patient to breathe. Breathe. Breathe in. Breathe out. Okay. Other side. Breathe in. Okay, breathe out. Okay, so what we are measuring here is how the volume, okay, the volume or the cross-sectional areas of the nasal cavity. So how open is it? Okay, so now we have that. We're going to be proceeding to the nasal septum. So for this part, we're going to be using the pen light here, the nasal cavities. So ask the patient to look up, and we're going to be looking inside. In here, we're looking for any lumps, bumps, or any redness, soreness, irritation. Is there any discharge? So as you can see in there, there's nothing, and there's no discharge or any very fluidy types of fluids. So we don't see any abnormalities. Now we're going to be inspecting the nasal septum that is still inside, so we're going to be still using the pen light. Look up, please. Alright. Okay, the other side. Alright, so you don't see any discoloration, or you don't see any redness, any lumps or bumps or anything covering the nasal septum. So that is good. So now we can ask the patient, can you breathe properly? Do you have any pain breathing?
No.
Now, do you have any problems breathing? Like, it's hard for you to breathe?
No.
No? Okay. So now we're gonna be inspecting the facial sinuses. So there are three. First is the frontal in here. We're gonna be palpating them, and we're gonna be observing for tenderness. So we have to ask the patient. So I'm gonna be inspecting it now. Now, okay.
Okay.
Okay. So tell me if there's any tenderness or any pain that you're feeling once I am palpating it. Can you feel anything?
No.
No. Okay. May I remove your glasses for a while?
Yes.
Okay. So in here, the ethmoid sinuses in here. Can you feel anything?
No.
No? Okay. How about in here? The maxillary sinuses. In here, can you feel?
No.
Alright, so that is good. So as we find those findings, we're going to be now documenting them. Now we're going to be doing the mouth and the oropharynx assessment for the client. So we're going to be inspecting first is the lips and the buccal mucosa, or the inside of the cheeks in here. Can you please open your mouth? It's there in the side. So what we're going to be doing, ma'am, is I'm going to be touching and palpating inside of your mouth. Is that alright?
Yes.
Okay, so the first thing that we're going to be doing is to inspect the outer area of the lip. So we're going to be first checking for the contours of the lip. Okay, we're going to be checking for the color. This one is darker than this on the lower lip. So in here it's pinkish, so it's good. So we're checking for the outer area if there is any infection or is there any lesions present. Can I see? Okay, there is none. So now we're also checking for the texture. Is it rough ba or not? So in here, we're gonna be asking the patient to purse their lips or like pretend they are whistling. Can you please parang put your mouth in a smaller form or shrink your mouth? There, pretend you're whistling. Okay, so now what we're going to be doing is to inspect and palpate the inner lips and the buccal mucosa for the color, moisture, texture, and the presence of any lesions. So please open your mouth. I'm going to be inspecting inside, okay? Okay, so here. Please lower down your tongue. Okay. Here. Okay. You can also use a pen light if it's dark inside. So we don't see any lesions. Okay. While we're at this, we're also going to be checking the teeth and the gums of the patient. So in here, please open your mouth. This is the can you close it a little bit? So in here, this is the gums, just right before the teeth. Then for the teeth, what I have observed is sorry is in here the patient has three front teeth in here. So instead of the normal where we have two big front teeth, the patient has three. So in the future, the patient may have braces or contact adapter to put in braces to her to fix the position of the teeth. So it would be better. So now if we see any denture or artificial teeth, they may take it out first. We ask the patient to take them out, and we will observe them if there is any damage already, or is there any torn or broken areas for that, so they could change it already. So now we're going to be inspecting the tongue and the floor of the mouth. So the first thing that we're going to be doing is to inspect the surface of the tongue. So please, can you open your mouth? Okay, can you put down your tongue? Okay, no, put down. Not, yeah, like that, flat down tongue. Okay, so in here we are inspecting or looking for the color, the position of the tongue, and the texture. So can you please open the tongue? Can you put it down? The tongue. Yeah, okay. So in here she has a pinkish tongue, so that is good. It's not completely white. It's not purple-ish. So there's hints of purple, but it's mostly pinkish na tongue. So that is good. So now we're gonna be inspecting for the tongue movement. So the first thing that we're going to be doing is ask the patient to roll the tongue upwards. So put your tongue upwards, open your mouth, and roll it upwards. Yan. Okay, so now we're going to be inspecting it by asking the patient to move it side by side. Yan. Okay, good. So we have the movement of the tongue. So the next one will be inspect the base of the tongue, so that where the mouth floor is there, so and the frenulum. So nice open po. Okay, this is the base of the tongue in here, and the base of the mouth floor rather, the tongue and the frenulum. Okay, so that is good. We don't see any abnormalities in there. So the next one we're going to be doing is ask the patient to place the tip of her tongue to the rooftop of the mouth. So open your mouth and put the tip of your tongue in the rooftop. Okay, so in there we can see this part of the lower portion of the tongue or the base of the tongue. So in there we don't see any abnormalities, no lesions, no bumps, no masses, no discharge, or there's no any other fluids aside from the saliva. So now we're going to be palpating the tongue using, so we have sterile gloves on. So we're going to be palpating the tongue and the floor of the mouth for any masses, any nodules, lumps, so in here. So open your mouth, please. Put down your tongue. Rest your tongue lang po. Ayan. Okay. Okay. Put it up a little. Okay, there's no bumps naman. It's soft. So, did you feel any pain?
No.
No. Okay, so there's none. So that is very good. So now we're gonna be using a piece of gauze pad in here to grasp the tongue, the tip of the tongue, because we're gonna be lifting it up a little to palpate the back of the tongue and the border. Okay. Now we have here. Again, we are wearing gloves, so it's clear. Okay, so please put put down your tongue. Okay. 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 We don't see any disorder there or any abnormalities. So that will be good. Her tongue and her floor area, mouth area is good. It's all good. So now we're going to be checking the salivary glands or the salivary duct in here, also the palates and the uvula. So for the salivary duct, we need the patient to open her mouth. Please open your mouth. Okay. So this is where all the saliva comes from. Then we are checking for the swelling of the duct. So we see none. Okay, so that is good. So now we're going to be inspecting the palates and the uvula. So first is to inspect the hard palate and the soft palate for color, shape, texture, and the presence of the bony prominence. Okay, please open your mouth. Okay, so in here we can see the bony structure in here. There. If you see it, it kind of looks like the spine too. So here is the soft palate in here. It's more inside of the mouth. Just the hard palate is commonly known as the rooftop of the mouth. So that is good. We did not find any abnormalities in there. So there's no any swelling, there's no discoloration, there is no lumps or bumps to be seen. So now next is we need to ask the patient to open their mouth. Okay, open your mouth, please. Okay, now tilt the head backwards so we have better view of the uvula. So now we're going to be depressing the tongue with the tongue blade or the tongue depressor. So we're going to be using the pen light here. So please put your tongue down now. Can you make it softer? Okay, so you got it good. So we need to inspect under the uvula, so for the position and the mobility while examining the plates. Okay, so just relax lang po. Relax lang. Okay, so we got that. So now we have to observe the uvula and we need to ask the patient to say ah for the soft palate to rise. Okay, say ah, open your mouth and ah. Okay, another one. Okay, again. Say ah. Okay, so now we see that it is rising, so that is normal. So that is good. That will be the end for the uvula and the palate. Now we're going to be inspecting the oropharynx and the tonsils. So for this part, we're going to be using the pen light and the tongue depressor tongue plate. So first, we're going to be inspecting the tongue, the oropharynx as a whole. This includes the tonsils, the back of the mouth talaga. So when we have that open, okay, we really have to press down. Okay. So in here, we're gonna be doing side by side inspection because it might to avoid gag reflexes. So please open. Relax. Side. Okay. Other side. Okay. So as I have observed, it is kind of hard to move her and see the inside part because she has a fat tongue and it's really occupying a lot of space, so she can't open it widely. So really have to press down with the tongue depressor to enable for us to see really deep down there. So next we're going to be inspecting the tonsils for the color, discharge, and the size. So again, we're going to be doing this. I will be adjusting around. Okay. Okay. So now we have that. I think it's normal lang naman. The size, there's no swelling, there's no extreme redness or any soreness, so that is good. So now we're gonna be doing the gag reflex. So we're gonna be putting it inside talaga so maano yung elicit yung gag reflex niya. Ready? Okay, I don't think she has a gag reflex. Again, we're gonna be trying it again. You can try to if you feel it, don't fight it, okay? So if you feel like you're gonna vomit, just do it. Or if not, then okay. She doesn't have a gag reflex. Anyways, now we're gonna be documenting our findings from the nose, ears, and mouth na we inspected and palpated. That would be all for this video.